Dr. Giugliano, what were the primary findings of the rival trial?
The rival trial was a randomized comparison of femoral versus radial access within the current OASIS study, which was a study in patients with acute coronary syndrome, including both ST elevation and non-ST elevation acute coronary syndromes. The primary outcome was a four-way composite of death, myocardial infarction, stroke, and non-CABG major bleeding, and this primary composite was no difference among those patients who were randomized to radial versus femoral access.
What other additional analyses were presented?
Well, there were a number of additional secondary analyses and other exploratory analyses that were presented today. Lesser types of bleeding and vascular complications occurred less frequently with radial access. There were also some provocative subgroup analyses. The most interesting one, I thought, was among the hospitals and operators who did quite a bit of radial access in their practice. They tended to have better results with radial access than did centers and operators who were less experienced.
What issues should readers pay particular attention to in interpreting these data?
Well, I always like to say that the primary result and the take-home message ought to be the primary endpoint, which in this case there was no difference between radial and femoral access for the primary composite endpoint. In a trial where the primary endpoint is neutral, then one has to be cautious when looking at secondary and exploratory analyses and be careful about over-interpreting. So here it was of interest that lesser types of bleeding and other post hoc bleeding analyses and endpoints such as the acuity bleeding were reduced with radial access. It was of interest that centers and operators who were more experienced with radial access tended to have better results, but we really ought to view those as hypothesis generating, and that's what one point we will make clear in our interpretation and summary of the article in the MD Conference Express.